Part of what makes me so passionate about this topic is I understand the difficulty and the challenges that come with addressing suicide and overdose risks. I also see that if we as healthcare professionals are not comfortable and competent in assessing and addressing risks of suicide and overdose, I don't know who will be. The second core element of Zero Suicide emphasizes training, with the goal of developing a competent and confident caring workforce. In order to do that, Zero Suicide offers the following outline. First, to assess staff skills, confidence, and attitude. Doing this allows organizations to tailor trainings specific to where needs are for staff. Included is to train agency staff on the Zero Suicide philosophy, policies, and procedures. Additionally, to provide trainings on evidence-based suicide prevention and treatment. We will look at these a little bit more closely. Providing a workforce survey allows an organization to start with a baseline to understand what the current attitudes and practice related to suicide care are. In the poster, we provide an example from the Institute how we've adopted this to get a better understanding as it relates to substance use treatment and overdose prevention. When thinking about training, it's important to consider to train all staff on the importance of identifying individuals at risk and responding effectively based on their roles. When I see this, I always think of the front desk. They answer the phones. They are oftentimes the very first contact clients have with the center. They're reaching out to ask for scheduling an intake appointment. The front desk is the first individuals who see clients as they come in for the day, waiting in the waiting room. A very important role, and to provide them with the understanding of how to be on the lookout and to respond when speaking with when identifying risks on the phone or in person in the waiting room. For our clinicians, we have a host of trainings based on roles. One of them is AMSR, Assessing and Managing Suicide Risk. It's a full day training and includes how to formulate suicide risk, communicate it to the patients, other providers, and document it. Can you imagine if we had a full day training on how to assess and manage overdose risk? Of course, there'd have to be a lot more treatment that we could wrap around that, but it would surely have a dramatic impact. So there's a lot of research that, and a lot is known about suicide over the years. And oftentimes you hear about how patients who die by suicide have frequently been engaged in care. And that circles back to the emphasis of the importance across the systems to be prepared on how to respond effectively. Unfortunately, there's little data on overdose deaths. However, there are evidence-based treatments emerging, and within systems like healthcare systems, having a consistent method and approach to addressing overdose risk can be accomplished. As we will see in the upcoming sections, identify, engage, and treat, there are a variety of tools and interventions which can be used in the prevention and treatment for overdose. What's most important is that organizations make a commitment to training so that the workforce can be informed and competent in what they do, so that there's consistency in how risks are identified, documented, and addressed.